How are burn classifications treated in construction first aid? Imagine seeing someone with a burn on site and wondering what to do next. Knowing how to treat different burn types can make a big difference in their recovery. When a burn happens in construction, it's important to identify how severe it is. Burns are mainly classified into first degree, second degree, and degree burns. Each type needs specific first aid steps to help limit damage and support healing. First-degree burns only affect the outer layer of the skin. They cause redness, pain, and sometimes swelling. To treat these, you should immediately cool the burn area with cool water for about 10 minutes. Use running water, not ice or very cold water, to avoid further tissue damage. After cooling, gently pat the area dry with a clean cloth and cover it with a sterile dressing or cloth. Do not apply creams, ointments, or ice because they can make the injury worse. If there are rings or tight clothing near the burn, remove them carefully to prevent constriction if swelling occurs. Second-degree burns go deeper into the skin and cause blistering and more intense pain. First aid for these burns also starts with cooling under running water for at least 10 minutes. Do not pop or break the blisters because they protect the underlying skin from infection. Cover the burn loosely with sterile gauze or a clean cloth. Keep a close on the person for signs of shock, such as pale skin, weakness, or shallow breathing. If the burn covers a large area or is on sensitive parts like the face, hands, or joints, seek emergency medical help right away. Degree burns are very serious. They destroy all layers of the skin and can damage underlying tissues. In construction first aid, the priority is to protect the person from further harm. Cover the burn loosely with a sterile, nonstick dressing and keep the person calm and still. Do not cool these burns with water because it can cause hypothermia. Avoid applying any creams, ointments, or breaking blisters. If possible, elevate the area to reduce swelling. Call emergency services immediately because these burns requiring urgent hospital treatment. Additional tips include not giving the person anything to eat or drink if the burn is large, as this can cause complications. If the burn happened in a fire or smoke environment, watch for inhalation injuries and keep the person sitting up. Providing oxygen if available can help. Never attempt advanced procedures like giving intravenous fluids or airway management unless you are trained. Always ensure your safety first to avoid injury. Never use ice, butter, gels, or lotions on burns as they can worsen tissue damage or infection risk. Keep monitoring for shock symptoms and be ready to perform basic life support if needed. In construction, burns can come from hot surfaces, chemicals, electricity, or flames. Proper first aid treatment tailored to the burn type can reduce severity and prevent complications. Quick and correct action helps the injured person recover faster and keeps everyone safe. Regular first aid training that covers burn management is a key part of skills development in construction careers.